much everyone for coming along to this hui or zui about how we can best support, how you can best support your communities in relation to lockdown and COVID. So I'll just kick off with a karakia and then I'll go through the order of our zui this afternoon. So, e rangi, e papa, e te whānau atua, whakatohia, tō koutou, manaakitanga, ko roto i tēnei mahi o mātou. So Sky Father and Earth Mother and the family of God, infuse your blessings upon this work. So thank you very much for everyone attending. I can see people are coming on board. So we will be recording this session, so I hope that's okay with everyone. We just want to be able to share it for those people who aren't able to attend. What I'll do is, and if you can put yourself on mute if you haven't already, that will be great. So for the first half of this meeting, we'll be providing you, hopefully, with information that helps you in your work and supporting your communities in hapu. And the second half of this zui will be for any questions you have, and also to let particularly emergency management, civil defence know what you need in order to be able to best support your communities. So please use your chat for any questions. Or put your hand up and we'll respond to those questions in the second half of the zui. So what I'll do is I'll just introduce our speakers for the first half of the zui. I won't be asking everyone to introduce themselves because we'll probably end up taking about a quarter of an hour. So first off, I'll introduce you to Teo Ursum, who's the Regional Council Community Resilience Advisor. And Teo will be talking about the role of caring for communities, the emergency management role, and the role of MSD. Kia ora, Teo. And kia ora, Jocelyn Stowers from the Bay of Plenty District Health Board, Emergency Planning Coordinator, and she'll be talking about the DHB plan for a resurgence, process for undertaking assessments and PPE. And kia ora, David Pearce, who's Community Manager at Western Bay of Plenty District Council, and Rowan Wallace, Emergency Management Manager at Tauranga City. And they'll be talking from a Western Bay of Plenty perspective, and we'll be responding to some of the questions you shared with us when you registered around funding and so on, and around essential service criteria. And finally, kia ora to Gayleen Street from Volunteer Bay of Plenty, who's a volunteer management consultant, and she'll be talking about how to get volunteers if you're needing them, and also health and safety for volunteers. And also to Kathy Webb from SociaLink, who organised this zui. So I'll leave it at that, and I'll hand over to our first speaker, who's Teo. Thank you, Teo.
Thanks, Liz. Thanks for inviting me and giving me the chance to talk about a little bit of what happened, but also for the future, hopefully I can give some insight there. First off, I want to acknowledge quite a few in the room that I've seen before during the response for their amazing work that they've done, coming from a emergency management, emergency operations center where we work together with quite a few of you. And it was amazing to have such community support. It was a big support for us in the emergency center to have the community so active. So thank you very much for, if you were involved, but also if you're still involved, because for some it's still ongoing. So I want to acknowledge that. As many are aware that during stepping down to level 1, Emergency Management Bay of Plenty stepped back from the work that they've done. So closing down the Emergency Operations Center and also the group center. And we passed all the work that we've done on to MSD, who are now working with those still in need. So they provide, during level 2, they provide financial support, food. You probably read something about that, about working together with food banks and accommodation support for those that are still in need. That means also that if people are required to go into self-isolation, they can still fall back on MSD for support. So that's still active. That doesn't mean that we at Emergency Management are not doing nothing and waiting for things to happen. There's a lot of planning growing in the background for when a resurgence happens in the Bay of Plenty. And I guess that's a difficult one because we're not sure what it's going to look like. You've seen it in Auckland. It could be regional, it could be multiple regions. It's depending on how big the resurgence is. And our planning will be scaling upon that, and also our response will be scaled upon how big it is. I've got one group, that's the foreign nationals. I just got some more information around foreign nationals, and not sure if Red Cross is on the line as well. It's still about 100 people per week. So foreign nationals that are seeking help. So there's still quite a bit of an influx coming there. So what does it mean for those that either want to continue what they're doing, supporting the COVID response, and also the recovery, or when there's a resurgence? And I guess it's coming back to, first off, is about yourselves and your family, making sure you're fine and are ready to serve and help. It's probably looking at the things that you've done already. Working from home is a big thing now. Doing meetings like we're doing now is quite common. So have those things in place if you haven't got them already. And it's thinking about, how do you inform your clientele? We saw, and now I'm talking about my work in the Emergency Operations Center in the welfare space, where we saw a lot of organizations not sure, they had to drop everything and they couldn't serve their clients or their customers. So think about what would you put in place if we go back to level 3? How can you still serve, or what other organization or what help can you get in to serve your community? Probably be flexible. Like I said, we're not sure what is going to happen. There's still a lot of planning done at Emergency Management Bay of Plenty. So be prepared for a small outbreak, but also for an outbreak that might last not just a couple of weeks, it could be months. So if you're going to step in, and I know that a lot of organizations stretch themselves during the response, can you maintain that? How are your staff levels? What is the stress levels of your staff currently? And how far can you push your staff? And what kind of support do you need to continue? So have those discussions now with your staff in your organization about, okay, well, what can I do? Do we want to do it again? Can we do it again? And if not, what organization can help out? So let's think about your capacity. A couple of organizations, I'm stealing a little bit of probably Galen's thunder here, is that organizations work together and swapping volunteers. Some of the organizations couldn't do their normal service because they had to stay at home. What about sharing volunteers where it's needed? And I know that there was one of the comments from the food bank about, yes, we need volunteers. There were quite a few other organizations. So I guess what I'm talking about is your business continuation plan. If you haven't got them already, it's time to work on that or update it, and just to be ready. What we've seen is with organizations that had done some preparations for it, they were a lot quicker in the response, and their staff understood what they could do and what they couldn't. So have a think about that. If you're looking for the caring of for communities framework, and also the network of network things that you might have heard before, and coming back to me working in welfare, it's about connecting to organizations that either provide the same services, or it could be a sector that you're connected to. It's time for you either to look into those connections, and keep those connections that you had during COVID. Because if you keep those connections, it will be a lot easier again to pick them up and make sure that you can work together. We've seen some amazing stuff during the response where community groups stepped up and pushed together. And I see Ellen here from the Katikati Community Center, getting other community groups together and work together. That's what we would like to see. If we're going to level 3, we're going to we will see some more community groups coming up, and we would like to work together with them. No matter what's going to happen, we want the community to take the lead, and the way I see it, and David, you can probably vouch for that, is about it's a community effort. So you've got the context locally, you know the clientele locally, and we don't. We can help you, we can assist you with resources, with funding, but you've got the hands locally. So it's a really important, and I think we were really lucky in our region with the community response that we had. So it's thinking about what cluster, and we're calling cluster, and I think Rome might be touching base on that, is about where does your organization fit in. It could be your sector, so the social sector. If you're working a lot with migrant groups, there might be another cluster that you want to be part of. So start looking for those connections for your organization and make sure you understand the organizations that are involved in that. If you make those connections now, again, it's easier to serve your community. The one thing, and that's coming back to us working in local welfare, there's a lot of really good initiatives. And I mean, you're talking about 50 to 100. And sometimes it's really difficult for us in an operations center to really find out, okay, well, what are you doing? And is your neighbor not doing the same thing? So we were quite selective in choosing who to work with. And we were linking organizations with the likes of Kati Kati Community Center. We had Tapuki as well. We linked some organizations to the local food bank in Tauranga, where they could connect and work together. So I think that's a really key thing to work towards. And if you have any questions, because going forward, there's a lot of planning. So if we go to level 3, and that's me talking, not my big boss, is about, yes, we will activate. So we will set up some centers to help out again. How that's going to look like, we're not sure yet. If you look at Auckland, who's gone to level 3, there's a lot of structures that have been put in place after the response. So I'm talking about MSD is assisting a lot in that area. So they still help out with funding for, financial support, food and accommodation. That's not something that what they've done there is not giving it back to the emergency operations center. I think that makes sense, and hopefully they're going to do it again. And the same thing in the Bay of Plenty, but I can't comment on that yet because they're still working on that. So it's again using the existing things that are there rather than an emergency operations center taking over and putting things in place. That's my notes there. If you've got any questions, let us know on the feed. To website, of course, is the COVID website. A lot of good documentation there, and the MB website supporting your organizations. And I'm sure your local councils here, David and Rowan, and I think I saw Alana as well, of Sophie. They're more than happy to help out if you've got any questions around that.
Kia ora, thank you, Teo. That was great. We've got one question in the chat, so thank you for that. We'll respond to that in the second half. Please do add to the chat if you've got any questions from what Teo's just been talking about, but thank you very much, Teo. So next we move on to Jocelyn from the Bay of Plenty DHB, who's got about 5 minutes to talk about what's happening at the DHB.
Kia ora koutou. Thanks very much, Liz, for inviting us along to speak about the DHB response and PPE. Our DHB has been active since the beginning of, or the end of January, really. So if there is a resurgence, we will continue to provide the response. So at the moment we have an emergency operations centre for the DHB, and we have an incident controller and a team of people that are working underneath that incident controller, and it's a unified response team. So we have Māori Health Gains and Development and Tōjora Public Health, who are part of that incident control at the top of our response. and we work really closely with Lakes DHB Incident Controller because our public health service are working across both sites. We also have a technical advisory group that is made up of infectious diseases consultants and the lab and other specialists from primary health and from ministry who are providing us information, and we are able to review what's happening at a national level, so that feeds into our response. And we have three other aspects to our response, which is the community-based health services, and in that are all of our contracted providers and non-government organisations, the primary health service and labs and all of the contracted providers. So the next aspect of that response is the hospital aspect and the provider arm, where we have an incident management team who are looking after the treatment services, the provider arm services, and we have Tauranga Public Health who are leading all of the contact tracing. At the moment, it's a national, the contact tracing is run nationally, so our Tauranga Public Health staff are supporting Auckland with their cluster control and following up on those tests. And we're also involved with any testing, and you would have been aware last week or the week before that Ministry asked us to provide tests for all of the port staff, and that was a mammoth exercise to actually get the port staff tested. Originally they said it would be the 6,000 staff, but it was dropped back to the essential workers that are in contact with the ships and the ship crew, who so all of the port workers have been tested and they've all come back negative. So that might be a piece of work that will be ongoing. So we have a team of people who are working at making sure that we can stand up our testing facilities. Currently, the GP services are doing all of the testing for Bay of Plenty, and we have GP liaison, and we work really closely with our PHOs to monitor how that's going. So the DHB incident management team have been having morning meetings with all of our providers, with representatives from the testing, from the provider arm, from the hospital services, just to monitor how things are going and discuss any issues. There's twice weekly meetings with Civil Defence and Tauranga Public Health and Lakes DHB to make sure that we've got a coordinated response there. And Ministry of Health is sending us on situation reports daily around what's happening nationally, and the emergency managers are also having twice weekly meetings just to discuss any other aspects of our response that we have queries about or that we anticipate we're going to have issues with. So we're fairly well connected as far as planning forward to see what will happen if we need to go into level 3. We will just upscale our response, and we've been there before, so we're ready to do that, and we've done a lot of debriefing to look at what aspects of our response worked well, what didn't work well, what new processes we can put in place to improve our response. Quite a few of the external health providers have done some debriefs so that they're feeding back to us what worked for them and what didn't work for them, so that we can try and improve our response to our external health providers. So that's in a nutshell pretty much how the DHBs are responding, and we produce a situation report that we circulate to the Ministry of Health and to Civil Defence and to Lakes DHB, so that we are joined up, and we receive the Tauranga Public Health situation reports. And all of the meetings are Zoom meetings, so that we're keeping our meter distance from people. So that's pretty much the response. We're trying to make sure that we have extra people to be able to do our response. We're trying to train up people now, because we found initially it was very time consuming, and staff needed breaks. And yeah, we've got the ability to set up community-based assessment centres if we need to. But at the moment, the GPs are managing really well with testing the people that need to be tested, and the labs have caught up with their results or testing, so that's really good news for us. Now, PPE, the ministry have changed the on the ministry website are the recommendations for what personal protective equipment that providers and health services should be using. And so we have our order form, which looks like that, and I can send that round so that it can be circulated. So we have someone who's dedicated to receiving those order forms via the PPE ordering at BOPDHB is the process. So we can circulate the order form, and it's monitored. We can't provide like a month's supply, because the Ministry of Health are very cautious about people using it in a, not appropriately, and we have to manage those supplies. But the DHB are still supplying our essential health workers and support services. So for those people who don't need to use that, use the personal protective equipment that's on our order form, it's a good idea to look at the reusable masks, or find a source of the reusable mask. We can't advertise those, because we would be seen to be having favourites, and we can't do that. But if you Google, then there are lots of suppliers of the cloth masks, and I believe that the recent information that the masks, the surgical masks, take hundreds of years to break down. So if people can be encouraged to use the cloth masks, that would be fabulous. And I'd also like to follow up from what Teo was saying about the staff. If you are able now for staff to have breaks, then that's a really good time before we go into another level, because people have worked really hard to keep us at the level we are now. And if you get an opportunity for staff to take that leave, then that's fabulous. Think about redeploying staff to areas that, some of the staff who may not be able to do the same job that they were doing before. There may be some admin roles or some other roles that they can undertake, so that you've got a bit of redundancy there if someone gets sick. And Tauranga Public Health they're now using a 4-on, 4-off roster, so that they can make sure that they can provide the contact tracing staff that they need. So that's the staff do a 10-hour day, 4 10-hour days, and then they have 4 days off, and staff are really enjoying that roster. So that's a really good thing to be able to do if you're able, if you need lots of staff, but it ensures that staff get adequate breaks. And we do have a template, a pandemic planning template that we could circulate. It was developed by Lakes and Bay of Plenty, so we can circulate that with the minutes. So that's me.
Thank you, Jocelyn. That's great. Yeah, if you could circulate the pandemic plan template and the order form for the PPE, we can send that out. Thank you. Just we're a little aware of time, but I'll be handing over now to Rowan and David. Thank you.
Kia ora, thank you everybody. Just be cognizant of time, because actually the majority of what we want to get is what you need rather than us telling you what we need. There's some explicit pieces though that we all need to understand for some clarity of how things are likely to be done. So as you've seen in Auckland was locked down from a regional perspective. For the Bay of Plenty, if we lock down as a region, it is not the regional council's boundaries. It is actually all of our territorial authority, so all of Rotorua district, all the way out to Opotiki, out towards Waiho Bay, and all the way up to Waihi Beach. So a rather large region that will effectively go into an increased alert level. So that means we could, for Bay of Plenty, it's massive. The restrictions that get applied also need to be seen from us as service entities to restrictions on our workplaces. So where you operate fits under a workplace. So that then has specific risk controls that need to be applied. There is a lot of guidance available on how to manage your restrictions that you need to in place for health and safety and good contact management. Unfortunately, they are everywhere. So if people are really interested, we can look to bring them all together into a package in one place so that it's easier for people to digest through. And if you have questions on what is required of you, we can then support to get answers for some of them. Other aspects that could impinge upon your operating is that community halls will effectively be closed under alert level 3. So that's council having to take actions. Freedom camping again becomes closed. So we have to then think about all of our individuals who freedom camp as a way of living and what we do there. So that again has implications on support services. The big piece I want to reiterate is that when you hear the term civil defence actually also means councils. So councils are civil defence emergency management group members. Until there is an emergency, it is the council acting on the council's ratepayers' money. The only difference when we shift into an emergency is instead of just using the ratepayers' money, we are able to tap into central government funding. Now, there are big restrictions on what we are allowed to use central government funding for. During the first lockdown, we were able to get into an appropriation of 30 million to provide essential household support through groups like yourselves or directly to whānau individuals who were affected. That fund has been exhausted, it's gone. So there is no current central government fund that we are aware of we can tap into. That means what we can use to support you is an extremely limited amount. So there are additional funds that are available through Ministry of Social Development. There's the Resilience and Capability Funds. There's a new Lotto grant that's come out, and there is still for Western Bay, a Detect Recovery Fund that you are able to apply to. We are doing our best to try and find all of the different funds that are out there to collate them so that we can share them with you so that you are able to apply. If you have questions about how to best answer the information needed to get into those funds, please do reach out to us so that we can do our best to help. Unfortunately, we are finding out about them quite late, so we're not able to get them out as fast as we would like. The big part that we'll continue to urge is that as we are working through lockdown, the role we have as emergency management is first off is coordination. That's not telling you what to do. It is ensuring that you can do what you do. So that information flow, please make it a two-way. You can ask us what you need in order to be able to do what you are doing, how you can make it safe, what restrictions are upon you, and we'll do our best to figure out how we can get that packaged back to you. The information that we will ask of you is to help us advocate on your behalf. That is why we will ask for how much you are doing. We will never ask you for whom you do it to as individuals. We may ask to break it down into types of individuals, such as Pacifica through to iwi hapu, or to migrant, or to culturally and linguistically diverse, because at the national level, they are different ministries and they have different funding streams. That's why we ask for it, so we can get access to those different funding elements. The big challenge that we have, and we recognized it from the fantastic feedback we had from you last time, is information flow. There is a digital divide. Not everyone has access to the internet. We well recognize that, but unfortunately that's where the majority of the information is. So if there is a means for us to support you to get information out better, we are open to it, because that's what we all recognize is the best way to make things happen. Give clarity for everyone, from those who need to demand for support, to those of us who provide the support, through to those who need to enable the support. They are the key components that I have, because I more want to listen to you than you listen to me. And that way we can answer some of the questions that are coming through. David, if you want to add anything from your experience in the last one as well.
No, nothing really, guys. Ryan, you're on a bit of a roll here. Thank you. Yeah, just happy to chip in if there's any questions come sitting my way in the second half. Thank you.
Awesome. Thank you very much, Rowan and David. And our final speaker is Gayleen from Volunteer Bay of Plenty.
Hi everyone. There's probably not a lot that I can add that you guys weren't already doing or are already doing. I think Theo hit on a good point about looking after yourselves and looking after your teams, keeping them safe, and I'm sure you all know the procedures, the guidelines you've got to follow when you are engaging with staff, whether they be paid staff or volunteers. We can help with providing volunteers if you tell us what you need. We've got a database that's got just over 4,000 registered volunteers throughout the Bay. So we are happy to help with providing, putting roles on our database, getting newsletters, getting communication out to those volunteers to see how they can help. We've also, in the last level 3 and 4, we sent an email out asking for volunteers who were already police vetted, who already had emergency management training. So we've got a list of those. There's about 36 volunteers, and they are spread throughout the Bay, so not all based in Tauranga. So we need you to tell us what you need so that we can do what we do. But for us, the prime thing is about keeping your volunteers safe, keeping the communication lines open with them. If they can't do their roles, what else can you get them to do? And again, talking to us to see if there are other organisations who not have a surplus as such, but have volunteers who can't do what they would currently or normally do, and how can you tap into that? So again, just keep the communication open with us. Let's learn from last time, let's fill those gaps, see how we can help you. So just keep in touch. That's me.
Awesome. Thank you very much, Gayleen. And I've realised as well, I forgot to introduce myself at the start of the Zooey. So for those of you who don't know me, I'm Liz, General Manager of SociaLink. We're getting in some really good questions. So I'm going to start with those, and please type in any more questions that you have. Remember, it's not just questions actually, it's also what do you need in order for you to be able to do your job well and to support your hapu and your communities. So also please do tell us that, so the emergency managers can do some work with that and see how they can help you. So first question up, it's from Helen. Thanks. I understand the council may be able to help us out with supplies of face masks. Is this correct? And if so, how can we get these? Is that a Rowan question?
Yeah, I can answer on behalf of TCC. So we were donated 10,000 face masks, so the doctor's versions, from our sister city Hitachi. They've already got out to a series of Hauora groups and also to Salvation Army to be able to provide out to community entities who are working in higher risk context work. From there, we don't have any further stocks. So if we are to procure them, that comes at a cost to ratepayer. We are waiting on further awareness out of the Ministry of Health for how they've provided the masks into Auckland through social groups to distribute to those that have had challenges and been able to get face masks, which I think will then answer a bit of Laura's question on how can we provide to homeless. We're still waiting to see the detail of that. It happened quickly, but we don't know how it fits. So Joss may know more. Aside from that, Tauranga City is not planning to be a provider of face masks. We do not have the logistics capability to do that, where Countdown and the other fast-moving consumer group entities like Mitre 10 and Bunnings do it much better.
Thank you.
Just to jump in from Western Bay District's perspective, no sister city or sister district, no donations, and unfortunately we don't have any masks to hand out, I'm sorry, so that's from us.
Thanks, David. And Davina from Salvation Army, I think, very kindly offered to share the TCC supply from here at the Salvation Army. So if anyone wants to get in touch with Davina, I don't know, Davina, are you happy for us to share your email out?
Yeah, that's absolutely fine. We were advised that they were first and foremost for agency use, especially where you are needing to be in that close contact. So that's what we'll be doing when just passing it out. We won't be giving it out to the public at this point in time. We were asked first and foremost for agency, so that we'll be keeping that.
Thank you, Davina. Okay. So from Sean Kingy, is there a process for death while in hospital in a lockdown 3 or 4, please? So I'm thinking that's a Jocelyn question.
Yes, there is a very clear process that the clinicians have around the death while in hospital that they are able to follow. I can't quote it without going back to relook at it because it's been a while since we've been in 3 or 4. But yeah, they have looked at those processes really closely and followed the Ministry of Health guidelines. And if you wanted to look at the Ministry of Health guidelines, you just go onto the website and they're quite clear there as well. I hope that answers the question.
Thanks, Jocelyn. Doesn't appear we've got any other questions. Is there anything people are requiring in order to support your community, your hapu? If we go into level 3, doesn't have to be through chat. Feel free to put your hand up. Got one. What about the wearing of masks on public transport? Rowan, you are nodding. Is that?
So there has been edict placed out that as of Monday, or actually 23:59 Sunday, all public transport will require individuals to wear a face covering, not prescriptive to a mask. So there are still questions being raised, both by community and ourselves and the seeding channels, of what does that mean for children on school buses, etc. Because there is guidance that face masks shouldn't be worn by people under the age of 12. So we've sought clarification on that, because it's just unclear. For what is a face covering, there is again some componentry out there, from scarves to homemade material coverings, whether it's double layer, triple layer, multitude of different ways. There's a lot of commentary around the pros and cons of wearing a mask, and there is there's some of the questions coming out that they create barriers as well, not just to communication. They also create barriers to people who have animals, because some animals respond differently to people wearing masks versus hoodies. For example, my dog will not allow anyone with a hoodie near me or my family, because he just doesn't trust them. So, and they also increase apprehension. Some of us like to not just look into the eyes of the person that is talking, they also want to see the full facial movement. So they are all factors we all need to work through, as well as some people struggle to communicate through a mask. So that often will require people to move closer, which also creates apprehension when we're all also trying to socially distance. So they are all components we need to think about how we do it. But yeah, it's not just masks.
Rowan, that's good. So that answers the supply question. I'm just going to jump back to Uta about kids travelling on buses and boats to school. So is that regarded as public transport? Are they required to have facial coverings?
It's unclear. We are asking those questions. And the civil defence group is trying to find it out.
And when you find out, how do we communicate that to people?
At the moment, the civil defence group is putting it out mostly through their social channels. We'll work with Teo as well to ensure that we can pass it out through all of our channels, particularly to this audience.
Thanks. Thanks, Rowan. So Maureen from Deaf Aotearoa, talking about the deaf community and wider harder of hearing, are worried about masks as this cuts down any communication to zero. And you're aware that there have been talks with MOH about specialist masks, but not sure when they'll get access to that. Jocelyn, anyone?
Yeah, I can follow that up with our NHC, with our National Health Coordination Centre contacts, to see whether there's any progress with that, as well as the wearing of masks for children. So I'll email them when I get off here and see what we can gather.
And do you know how to get in touch with Maureen to pass that information on?
Yes, I do. Yes, thanks.
Thanks. Okay, and Sophie, is there any thought resource going into the improving internet device access for communities that need it? I'm not sure who to direct that to.
So this is where the Capability and Resilience Fund is able to be accessed, and it will come down to what the actual support requirement is, whether it's the physical devices themselves to get you access, or that you need to have better data coverage, either via improved telco through what used to be Spark, to digital access, because they are bigger capital investments that we can only advocate for, rather than do small scale funding support. So yeah, if we can have some greater awareness around what that need is, then we can definitely take it up and see how we can talk to people who make things happen.
Just to follow up on that, Liz, I made a submission to the annual plan earlier this year, well, while we're in lockdown, around getting better internet access for Maryvale, because it's more of it's not really about being in a rural area or not having that actual access, but it's about the costs associated with that and the barriers that are up for people. So yeah, I asked whether TCC was going to see if they can improve that in some way, because I know somewhere down in Christchurch they did like mobile hotspots in communities of need. who may not be able to afford internet access. So something like that might be something I'd be keen to talk to someone about.
Cool. I'll take that back into council to see where we're best seeing it fit, and whether or not we can go into those grant areas to effectively empower communities to get the resources for themselves.
Great, thank you, Rowan. And Helen asking, clarifying the Lotto grant that someone mentioned. Rowan, do you want to, I think there's an email gone out as well, or various emails about that grant, but Rowan, are you able to?
Yeah, so it's another new grant that's come in. I don't have full visibility on it, I just know it's appeared. So what we can do is pull all of those grant information that we do have, put it onto a communique and get it out to everybody, so you know where to access it, what kind of fundamentals you can apply for, when is it closing, and where we can provide any advice or support.
If you're on the SociaLink newsletter list, and I think you are, Sophie, it's actually coming out tomorrow in our newsletter also.
Just clarifying around the facial coverings or masks, so that it is a requirement to be on public transport regardless of, I know you were saying, Rowan, about concerns about animals getting freaked out and so on, but that is a requirement, isn't it? Yep.
Yep, it's already been placed into the health notice, effectively, which makes it law if we are alert level 2 or above. Public transport, which is Ubers, taxis, planes, buses, trains, all require you to have a form of face covering. And if people are not aware why, the face covering is to stop effectively you spitting. It's not just to stop you ingesting. It's a two-way transmission support system. And the reason it's done is quite simply, you are in a confined space with strangers for a period of time.
Okay, thanks for clarifying that. And thank you to Patrick Davies, not related, from Community Networks Aotearoa, who has a link to the lotteries grant. Any other questions? We've still got a little bit of time.
Yeah, just one issue around if we go into lockdown, it's really important that providers have for their staff a photo ID or a letter to ensure that they can get across a boundary. If they're living outside the boundary and need to go to work inside the boundary, then it's really difficult if they don't have their photo ID or a letter from the organisation they work for. Does that make sense?
So I'm aware of people who, some of the early childhood centres we've been supporting with their evacuation planning, where they have children coming from as far as Tiro. So that's coming from outside of the Bay of Plenty Civil Defence Group region. So they would not be able to transit in unless they had an essential travel waiver. And they are quite restrictive, as Auckland has found out. So if you need to look at your staff, where they are moving from, if they can still move, where if they have dependents, they need to also move, because that may create restrictions for them. So then we can factor in how that can be achieved.
Thanks, Rowan. Alice, you mentioned something about have info read data. I'm not quite sure.
Yeah,
Is that
kia ora.
Kia ora.
Yeah, kia ora, Liz. My daughter's just doing piano lessons in the background, trying to keep out of mischief. So for her poorly piano playing. Kia ora. Yeah, just mentioned earlier in regards to concern of data and affordability. Shannon Bristow at the Tauranga City Council, I'll be meeting with her this afternoon over Zoom. She's actually in charge of doing Skinny Jump, which is affordability of $5 a month for 10 gig. And they actually sending out, they also have modems set up for people to go. So I'm doing a bit of training session with her this afternoon for our hapu. So It's for people that meets the criteria of, that can't afford it, they don't have a modem. You know, so it's a really way of this funding that they have. So if you want any more information, I can give you her name. So it's for anyone that basically can't afford it, and it was set up because of what's happened. It's something they've got a deal going with Skinny at the moment. It's what they call a skinny jump to help one.
Kia ora, Alice. Thank you very much. Is the information about that, where's that available, or are you able to send something through, Alice? Or?
Shannon Bristow at the Tauranga City Council Library. She's in charge in that area, and she actually does workshops and sign people up. And if people sign up on the day, actually it's 30 gig, I forgot, it's 30 gig. They'll do it for free. She'll send out modems to ones. Basically, our help, we wanted to set up a workshop because we know of whānau that can't afford it. You know, and during the lockdown, it was so hard because they didn't have the affordability of a modem or the startup. At $5 for 30 gigs a month is magic. You know, it just gives them that thing to be in touch and to help the kids. So yeah, so it's free. It's all free. They just got to pay their $5 a month. But so I'll be doing a workshop with her soon after this to get more information and give her details of ones that need this, and it fits that criteria of affordability. That hasn't got they got to be without internet and a modem to get that criteria. Yeah.
Awesome, thank you, Alice. And I think Rowan and Davina have just also added links onto the chat about how to access information, and your daughter's piano playing was lovely. Thank you for that.
Please also say digital enablement is a significant component to connectedness, therefore resilience. So it is one aspect that it is championed as part of the MSD Resilience Fund. So it's a piece you can actually ask for funding to get for you.
Great, thank you. And Maureen's just advised that in terms, there are sort of a few limitations on what you can do with that amount of data. I'm aware of time. Is there any other questions? Otherwise, we just wanted to check with you as well whether you found this session useful, and if you would like to hold similar sessions, which either SociaLink can facilitate, or if you'd prefer to do it more directly with sort of emergency management. Any feedback on that would be really helpful.
Tēnā tātou, I've just got a pātai actually, too. With our, to our DHB, what I asked in terms of mate, is there any resources that can be sent out to especially Māori? Now we know Māori, when it comes to death, there's a lot of emotions with anyone, but preparing them now while we're in level 2, is there something available to, especially to our Māori leaders within our marae, within the rohe of Tauranga Moana? So that's one question. And then the other pātai, sorry to take up your time,
that's fine.
Was in regards to the connectivity and communications. Now I understand that there is the jump, which is very affordable, but the families that we're dealing with have absolutely no power, no water. So what is the communication plan to get to those ones that don't have access to water, don't have access to power? Kia ora.
Kia ora. Is that Rowan, David, Teo?
Kia ora, thank you, Sian. Excellent question. So we'll work with Joss to get some content alongside with Carlo from the Takawainga team to be able to produce out some package for you. What would be your preferred method is what we would ask for, how we do regular communications out to those who do not have digital access. Is community newspapers useful, or do you prefer a more explicit, please excuse the term, targeted product that goes to that audience? That's what will help us therefore go and get these things moving.
Sean, did you? Oh, sorry. Yep.
Yeah, sorry. Yeah, I think it needs to be targeted specific to the paper, so the newspaper within.
I think you're cutting out.
What I'll do, Liz, I'll talk to our Takawaian team and alongside David with Western Bay's one to see whether we do a dual cut of community newspapers like the Sun, as well as a specific newsletter that we can make a bit more specific to audiences. And that's open to other culturally or linguistically diverse communities. If that's what is preferred for you to get the information, then that's the actions that we can take. We understand that, you know, the best action we can provide you is clarity of information.
Thank you. So just on the question of, is this kind of Zooey something that would be useful to hold again? Maybe if you are interested, maybe show of, don't feel like you have to either. I understand if you don't. Okay, so it looks like there is some support with that. I'm just thinking, and well, I suppose timing, I think we might need to judge that on changes. It's a bit of an uncertain environment, but that's something we definitely can look at, whether that's SociaLink or emergency management.
So the next big update is the 6th of September from Cabinet. So I would suggest post that unless the situation completely changes and a new cluster erupts somewhere that, well, I hope doesn't happen.
Okay, so potentially looking at some time post 6th of September. Thank you. And just a final one from Maureen about putting info onto New Zealand SL on council website. Good point. Thank you, Maureen. Great way of getting the message out. Any other final comments? Otherwise,
yeah, Liz. Hello. I think this is great, and I think even more so if we if things do change with levels, if we've already got this connection and people are already in this group, as things change and evolve, we'll have the opportunity to check in with each other and see, you know, what support is happening out there, which is what we didn't have last time. We didn't have this, you know, before the lockdown started. So I'm really keen to be able to talk to different community groups like this in the event that the
and I'll put my email address. Yeah, I'll put my email address on the information I send out, and I'm happy for people to call me if there is additional information that they request, because if we don't know about it, we won't be able to produce it. So thanks. I think it's been a wonderful forum for sharing information.
Awesome. And I mean, we can also potentially get MSD to the next hui would be good. And also potentially, as you say, it might be more about sharing between each other and not just us imparting information. I'm just aware of the time. So thank you so much, everyone, for coming along to this Zooey. And I'd really like to thank TCC, Western Bay Regional Council, DHB and Volunteer Bay of Plenty, who all came together to organise this hui and speak. And I'll just finish off with a karakia. So, kua mutu a mātou mahi, mō tēnei wā, mana kitia mai mātou katoa, o mātou hoa, o mātou whānau, ao ki te aurangi. Our work is finished for the moment. Blessing upon us all, our friends and our families. So thank you very much for your time, and I hope you have learnt something that you didn't know before 2 o'clock. And it looks like we'll be all meeting again in, gosh, a couple of weeks. So thank you very much. Enjoy the rest of your afternoon.
Thank you, everybody. Ka kite no.
Ka kite.
Thanks all.